Hi, my name's Fiona, and in this short video I'd like to show you how an ophthalmoscope works and how you can use this instrument to examine an eye. Many students, and qualified doctors for that matter, may tremble at the prospect of examining an eye. However, all you need is a system, a basic knowledge of the anatomy of the eye, and the ability to use an ophthalmoscope. Simple in theory, but clear instruction and practice in this skill is essential. First of all, you need to check your equipment and make sure it works before starting your examination. If the batteries are flat, or if a colleague has left the ophthalmoscope off its charger, there will be no light and you will not be able to see anything. Believe me, there's nothing more frustrating than a flat scope, so always make sure that when you finish using this equipment, turn it off and if necessary return it to its charger. Now, there are many types of ophthalmoscopes, but essentially they all work in the same way. Firstly, you should be able to identify the on-off dial, and it's with this that you can alter the illumination. You need to ensure there is adequate light. Next, you should be able to find a dial that can be turned either clockwise or anti-clockwise. This adjusts the power of the lens within the ophthalmoscope and should be set for the moment to 0. Some ophthalmoscopes may come with a series of apertures or filters. As you can see, this can adjust the spot size. If you've got one, just remember small spots for small pupils and large spots for large pupils. Don't worry about the colours for now. Right, so you've checked your equipment, it works, and so you can begin your examination. First of all, as with anything, you do need to make sure you've cleaned your hands before you go near your patient. And next, you have to explain to the patient what it is you're going to do. Ideally, it should be good to use dilating drops, usually a very short-acting dilating drop such as tropicamide. Patients should be warned, however, that this may blur their vision for an hour or so. If you can, try to dim the room lights, particularly if you're attempting fundoscopy undilated. First of all, ask the patient to look straight ahead and place your hand on their forehead. At an arm's length, put the ophthalmoscope up to your right eye and look for the red reflex, swinging the light over to the left eye. Now, the red reflex is the result of light reflecting back from the retina. If no red reflex is seen, either your technique is poor or there's a significant problem with the eye regarding the clarity of one of the optical media. And from front to back, this could be due to a problem with the cornea, the anterior chamber, the lens, or the vitreous cavity. You will look silly if you attempt fundoscopy with no red reflex. Once the red reflex is identified, proceed to examine the right eye, your right eye to their right eye. Come progressively closer until you start to see retinal detail. Don't be surprised how close you need to come, although touching noses means you've gone too far. To focus the retinal image, you may have to rotate the lenses either clockwise or anti-clockwise. This is to account for potential focusing differences, or refractive errors, that may exist either with you and/or the patient. If you wear very strong glasses, it may be best to keep these on. Right, here we go. Remember, the image you obtain will be highly magnified. You will not see a fundal picture depicted in textbooks, but a small circular image which you have to piece together to produce your own picture. Please don't panic, think logically. Have a system. The most likely structure you will see is a retinal vessel. Follow this either up or down to reach the optic disc. Starting at the disc, which should be nice and pink with vessels entering and leaving, remember the 3 C's: cup, colour, contour. Now follow the 4 vascular arcades, remembering each has a retinal artery and a retinal vein. Then ask the patient to look up, down, left and right, following the patient's eye at all times. It's here that you will be allowed to pick up peripheral changes. Finally, ask the patient to look directly at the light. This will bring the macula into direct view. This can be very uncomfortable and should be the last thing you do. Repeat the above on the fellow eye, this time using your left eye. Not easy at first, but you must practice. So there we are. How to use an ophthalmoscope. Make the most of all the opportunities to practice this skill. You will have the opportunity to perfect your technique during our workshops.